Part of that is simply because this virus is new. Anything new gets more attention. Part of it is that we have had the flu for so long, nobody is as concerned anymore by the flu unless they are in that high-risk group. There are still people who, if you go on Facebook and you talk to some of your immunocompromised friends, they'll say, this is my life. If they have, for example, cystic fibrosis, they have been wiping out the counters every single day for their entire life. They've been wearing masks when they're concerned every day for their entire life. They've been avoiding large groups there where they might possibly get sick for every day of their life. So for the people who are most affected by this virus, their life hasn't changed that much. They have to be just as careful as they were before. But for those of us who have strong immune systems, who haven't had to face something like this before, it can be a little bit alarming simply because it's new and because everybody is talking about it. However, statistics right now are showing that the strong majority of people who contract this virus will have mild symptoms only and will recover well, just like with the flu. Now, there are early statistics that indicate this might have a slightly higher fatality rate. And because of that, also, we are trying to be a little bit more careful. Now, in the event of an emergency, county operations will do their absolute best to keep everything open that is required to prevent loss of life. That includes things like places that you need to go to get life-saving medications. However, it is a good idea at this point to try to talk to your physician to see if there is some way that you can get advanced prescriptions. Now, that is a decision that they will have to make, but often in situations of crisis or of disaster, which we have not reached yet, I do want to be clear about that, but we are preparing for, there will be physicians who understand and who will make exceptions. So I recommend, if you are facing that sort of dilemma, that you reach out to your physician and you explain your situation and give them an opportunity to either give you an alternate or an alternative option, or to maybe forward that prescription 1 month ahead just this one time. It really is up to them. In some ways, they're right. There is no reason right now to feel like the world is coming to an end. It's not. Our health officials, our public health officials, and our hospitals and our physicians, we have prepared for this. We train for this. We have people who are ready to respond. Our investigators are looking into all of these cases. They are ready for this, and they do this on a daily basis with a number of other viral infections. This isn't new to Idaho. This has gained quite a bit of attention because of the spread of this particular virus, but it does not mean that your way of life needs to come to an end, especially not for the foreseeable future, maybe for a couple of weeks or at the most a couple of months. But we absolutely intend at some point to get back to regular life. So for the people who believe that we shouldn't have any sort of precautions, I would recommend that you take a second look at the people around you who need you to be a little bit more careful. For the people who are concerned and want all of society to shut down, I also say your concern is valid. However, we haven't reached that point yet. There is no widespread contagion in Idaho right now. We're closely monitoring this virus, but we have investigation teams tracking down everybody who might have been exposed to the virus through confirmed cases. Those people will be contacted and will be isolated at home. We have this under control, and if it gets to the point where we do have widespread contagion, there will be extra recommendations that will be put out by public health and by your local administration, like your county leaders and your city leaders. I really recommend people, they follow the recommendations that are out there right now, but they don't let this keep them up at night. Whenever we have an infectious disease like this one, our public health professionals respond immediately and effectively. However, it does require the unified effort of the entire community, and that's why we've been putting out these recommendations to try to keep distance between you and other people, to stay home when you are sick, to make sure that if you are showing symptoms, you call your doctor and you discuss the risks. Now, it is possible with any kind of infectious disease that at some point it will get to the point that it makes more sense for everybody to stay home for a couple of days so that we can get a little bit of a better head start on it, so we can get around the curve and make sure that we're making more progress. That does take pretty specific conditions. A lot of schools are just trying to take precautions and protect their communities by limiting contact. And as you know, in schools, there are lots of children with close contact, and even though they encourage proper hand washing, good hygiene, children are children, and there's no 100% way of making sure that they are following those recommendations. Now, From the health district, we have not issued a recommendation to close schools, but we do appreciate the precautions and the concern of our local school districts, and we do support their decision at this point to close down. I do want to reassure people that right now, children are not seeming to be quite as affected as, say, typical flu strains. So that is the one silver lining. If you do have small children and you are very concerned right now, they seem to bounce back pretty well. And if they do contract the virus, they do seem to show very mild symptoms. That's a really good question because there is a lot of overlap. As you know, with allergies, it's very common to have a runny nose, runny eyes. It's common to sneeze and to cough. Those are also very common for flu. And with COVID-19, the most common symptoms, or at least the first most common symptoms, are fever, cough, and shortness of breath. Now, if you have an allergy, you shouldn't have a fever. That indicates that there is some sort of virus or something like that attacking your system. So if you have a fever, you know that there's something happening. You should immediately self-isolate so that you don't pass it on to anyone else, whatever it is, even if it's a simple cold, and you call your doctor and say, this is what I'm facing right now. These are my symptoms. Now, your doctor will likely, if he or she asks you to come in to get tested, they will likely test you for something like flu first. Now, part of that is because the response is faster, so they can find out more quickly whether or not you have one of those, but it's also partly because it's a lot more common than COVID-19. To give a little bit of perspective, right now, and these numbers were just updated this morning, it looks like more than 400 people have been tested for COVID-19 in Idaho. Only 9 people have come back positive for that disease. That tells you that there are other viruses out there attacking our system. Now, if you have a situation where you are experiencing something like difficulty breathing, chest pain, confusion, or drowsiness to the point that you can't wake up, or you're having a difficult time breathing so your lips are bluish, if you have any sort of medical emergency, you need to call 911. And if you call 911, please be clear to the dispatcher or whoever is calling. Please be clear to the dispatcher if you have any concerns that might be COVID-19 so they can also take precautions. The most important thing right now is that, once again, we work together. We trust our physicians. We understand that they are getting the latest guidance from healthcare professionals at the state level, at the federal level, and at the local level. Idaho is ready for this. Our healthcare professionals have been trained. They have worked on this. They have responded to many viruses in the past and know how to respond to this one. And if there is community spread, there might be more recommendations. So make sure that you are checking for those recommendations. You're following public health on social media. You're checking our website for updates there as well. The governor has his own channels as well if you'd like to look there on both Twitter and Facebook. Those updates will also help prepare you. We want to help you. Let us help you. And in the meantime, wash those hands.
And stop buying all the toilet paper.
Yes, that's not going to protect you.